You know, this morning when I left, wasn't like this. What about those 3 dots?
Where?
Those aren't anything. We already went to those 3 dots.
I didn't do it.
It's set on the, it's set in the,
I hear something.
Hey everybody. So we for some reason we're not able to stream it to YouTube today, so we're recording it and we'll upload it to YouTube later, I guess. I don't know what's going on.
Hello?
Hey Tom. We'll get started in just a second. Sorry for the delay. I think we are just waiting on one other person.
Can you see me?
I cannot see you.
I can't. Well, I'm on my phone.
Okay.
Well, I can't see myself either.
Yeah, the only person I can see is me.
I can see Michelle and you.
Okay, there's Michelle, yeah.
Oh,
Oh, there's Pam. Okay, hi Pam.
Morning. Morning.
you're-
And there's
Okay.
Dirk. All right. We got Dirk.
that was my error.
I can't see anybody else. No way.
Do you want us to mute ourselves?
Yeah, sure, that'd be great until we have questions and then we'll.
I understand the sound is better for everybody if we mute. Okay.
Hi, Tom.
Good morning.
You're not next door.
I'm out at the lake.
Yes.
Well, there you are.
Is it raining there, Tom?
It did last
No,
night.
it did last night. The night before, we got almost 2 inches. So we were able to find all the leaks on our camper. You've been enjoying your free paper, Dirk?
I have.
Good.
All
Thank
right, well, we've got everybody except Kristen, and I've got 11:02, so I guess we might as well go ahead and get started here. So let me pull up our agenda. Okay, let's see. Okay, looks like Kristen just sent a note. Michelle, can you send Kristen the Zoom info? She apparently didn't get it for some reason. I'm gonna try and share my screen with the agenda on it. Okay, here we go. Sorry, you gotta love technical difficulties, right? So our first item is to approve the minutes from last Monday. I kept those fairly simple. Anybody
So
have
moved.
any questions? Okay.
Second,
And a second. All right. Any discussion? All those in favor say aye.
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 Okay. Any opposed? All right, that motion passes. We have some minutes. Okay, our next item was statistics on COVID-19. And so do you have an actual,
I just sent you a new spreadsheet.
Okay.
So let's just pull it up.
Jason is here in the room with me and claims to have sent me something. There we go. Okay, so let me move that to Zoom. Okay, can everybody see this spreadsheet now?
No?
no,
Okay.
Go up screen sharing.
Ah,
Special
okay.
share. There you go.
Now,
Now you should be able to see.
yes,
okay,
Okay.
great. So, so Jason Tiller is our health officer. He is here in the room and he has the information. As you'll recall, one of our charges on the committee is to evaluate disproportionate impact of the COVID-19 pandemic on racial and ethnic minorities. And so Jason has our local Saline County information on that. This doesn't have the baseline information,
It's got the Saline County population by percentage there to the right.
but not down here. Do we have this?
No, I pulled that one back up.
Okay.
Of course, you know, Murphy's Law, whatever happened will happen. So I had some nice,
Yeah, Jason
pretty
had a
slides
really
done up, and then
nice slide, and then crisis came up this morning. So
yeah, so what we have then instead is the spreadsheet. Actually, if you want to throw the baseline, it's that chart right there has the baseline percentages.
okay, I'll try and fiddle with that while you talk about
Yeah.
this.
So, so this first column A here just represents the race breakdown of our cases. And this is based off of our case count as of end of day Friday when we had 268. Part of the reason I had to kind of redo some of the numbers real quick was that when I started putting the numbers together on Friday, we had about 6 more cases that had come in after the fact. And so I wanted to make sure that this information as far as case numbers married up with what we have on our dashboard, so that the stats, at least for what's currently being reported right now, would match up with that. So the first column there is just the calculation of what that race represents as far as in the number of case counts. So in Saline County, out of our 268 total cases, 218 of those are white, which represents 81.3% of our total cases in that demographic. And in that far right-hand column, Saline County population, you can see that our total population, according to the the Kansas Health Matters, in their 2018 data, which pulls from the census, was that the Saline County is predominantly 90.2% white. Unknown right now, as far as race, just represents about 7%, and that's just filling in some blanks that that weren't filled in early on that we're working on. Looking down further at the percentages, as far as the breakdown of cases, we have had 12 that were Black, 7 Native American, another 7 that were other, 3 that were Asian, and 1 that falls into the Hawaiian or Pacific Islander category. And they are close, except for the Native American block there, and a little bit elevated, I guess you would say, on the representation of Blacks as far as cases in this cross-sector, or this cohort of cases. As far as representing what the Saline County population demographics look like. And then further under ethnicity, the demographics are broken down by not Hispanic or Latino, which most of those, the way it is broken down by census is most people that are Hispanic or Latino, as far as race, actually fall under the category of white and as far as the classification of race. But you can see the breakdown of ethnicities there. 70% do not identify as having a Hispanic heritage or ethnicity. 20% do, and then 9% is unknown at this point as we fill in additional blanks on the data. Male and female, it's about a 50-50 split between genders.
So this is the information, because you didn't have the baseline information on.
That 11.4 and
Ethnicity.
80.1 are the baseline
Right.
from Kansas Health Matters. So
basically 11% of the population in Saline County is Latino or Hispanic, but they represent over 20% of the cases.
Yeah, I had to look at my numbers.
Right.
Yeah.
So there's a significant, I mean, I haven't run the regression analysis, but there appears to be a significant difference between, or disproportionate impact, I guess we'll say, on the Latino population in terms of their COVID incidence, but all the other categories are around the same as their population.
Pretty close to it. Black is a little bit higher than as far as their case numbers and that percentage versus their population numbers, 4.5 versus 3.6. Like I say, Native American is 2.6 versus 0.8. And then Asian is actually half, where they only account for 1.1% of the case numbers, but 2.3% of the population.
Okay. So we'll try and get this information cleaned up, get it back into Jason's original format, and then send that out to, it looks like Krista might be waiting to get into the meeting now.
Phil, would you say that's enough data to draw a conclusion?
How do I get back to this stupid meeting?
Go up to the top.
How do I just stop sharing?
If you click on the red button that says stop share.
There we go. Okay. No, I do not see Kristen waiting. Sorry, I got a note that said Kristen was waiting, but I do not see her. Okay. Okay, so back to the question, is that enough information to draw any conclusions? I don't know, with the representation of the Latino community in that data, you might be able to say that there's some conclusion. I think all the other ethnicity is probably, you know, the raw numbers are so small that it might be a little hard to draw anything conclusive. So I'm not sure what we do with that information as a practical matter, but we have evaluated it, so.
Yeah, because I mean, our case count only represents less than 0.5% of the total county population based off of the 2018 values. So it's not a very big sample size.
So like I said, we'll try and get this cleaned up and back in the format that Jason originally intended to present, and then we will distribute that out to the committee, and then we can evaluate that again, I guess, next week. We can put this item back on the agenda just to talk a little bit more after we're all kind of, you know, able to look at the numbers. And
that'll give us some time to digest it.
Yeah.
And see what other questions they have.
okay, so then if I go back to here. Okay. So the third item was update on state guidance. So the state, I'm just going to use this to give you some updates generally, but I'll say the state continues to roll out new information. I don't know if anybody was able to attend Friday afternoon's webinar. I was on that along with some other staff. They said a couple of things that actually directly conflicted with things they had said the previous week, so that's fun. But they're supposed to be getting out an updated FAQ list and oh, now I see Kristen. They're supposed to be getting out an updated FAQ list and also a, what was the other thing? They did release the updated spreadsheets. And so we've been working with the updated spreadsheets. Today at 1, the Spark committee is going to be meeting, and they're going to be discussing phase 2 funding from the state. So just to recap, the state got $1 billion. The money that we're talking about is part of the first $400 million. They kept back $600 million for phase 2 and phase 3. So they're supposed to be discussing that this afternoon at 1. We'll try and listen in on that and see, you know, how that might shape or color what we want to do here locally. Just a few other sort of
excuse me.
Yep.
Yeah, it would be really helpful to me to know what the state has done with the phase 1 money.
The phase 1 money is what they dumped on us.
And that was all Or did they do other things with the phase one money?
No,
Okay,
the phase one,
Okay.
the 400 million, they divide it up among the 105 counties, and we get 11 million of that.
okay.
Yep.
Then,
And Phil, this is Kristen. I have a question. I'm sorry, I had trouble getting in. Have you already approved the minutes? Or are you making
We
introductory remarks?
did approve the minutes. Was there a correction to them?
No, just I had a question regarding whether you were keeping the commissioners apprised of where we are, because we kind of quickly came together with wanting to find housing, healthcare, and food security for children. But
Well,
if,
we're going to talk about that under item 5 today.
okay, I just didn't want us to surprise them.
Yes. So I do have every Tuesday, I'm reporting out, hey, the committee met, here's what we talked about. So
All right, thank you.
yes,
Okay.
I am keeping them apprised, but we'll talk more about our strategy stuff here in a minute. But
Thank you. All right.
yep. Okay, so just a couple more quick updates. In terms of, first off, the cash, we have it. Treasurer's office reported that this morning we did get a deposit in Bennington State Bank of $11,026,434. So we officially have the cash. Secondly, we had talked about additional assistance for staff and for the committee to help, manage all of this. And so I did talk this morning with a professor out at K-State Salina. She's an accounting professor out there, and she would be willing to help us out. So she is supposed to be getting me a proposal today for that. And so got that rolling. And then I got an update from our staff, just in terms of our numbers. We have so far at the county level, which includes the county and the building authority, just shy of $60,000 in reimbursable expenses, $15,376.94 in personnel costs, and $44,055.33 in accounts payable. I have, as of yet, had zero response from any of the cities or the school districts. Of course, we gave them until this Friday to get us something, but none of them have contacted me at all about even questions or anything. So I'm hoping they're tracking with all of this.
Phil, excuse me again. How are you guys doing on building a list of CARES Act resources already distributed within the community? We had asked for that.
Right. So we'll move to that. So Michelle had put together, let's see, share this one. Okay, this might be a little hard to read, but Michelle had started putting together the different funding sources, and so this first part up here, there was 192 billion that the feds distributed under the sort of the first stimulus before the CARES Act, the Families First Coronavirus Act. And so there are a number of different categories broken down around nutrition and testing and unemployment insurance. So one of the things is, this is, all the federal money. And so Michelle is trying to follow up and see what did people here locally get. So for example, there was 250 million in nutrition for seniors, Native Americans, and the disabled, I believe our senior center got a portion of this money. I mean, obviously not millions, but I think we got 10,000 or something like that. So we need to now tie this back in terms of what people have actually gotten. The Paycheck Protection Program, that was sort of one of the biggies. So we know that there have been a number of folks here in the community that have received that. Michelle has a call in to try and figure out exactly. And do you, Eric Brown with the Chamber is here in the room, do you have a sense of exactly how much we've gotten locally in PPP?
Not an aggregate number.
Okay.
The survey I did, I think 90% of the respondents said that they got some form of PPP or EIDL money from SBA.
Okay. So we're definitely, you know, it's definitely getting distributed, but we don't have a real accurate sense of what the local impact of that is. And then this is the, what's that?
Oh, I just want to thank both of you. That is a big task, and it's not easy, it looks like, to piece it together, but we sure need that information. So I appreciate what you've done so far.
Right. So, so then the CARES Act, these are all the pieces. That was, we pretty much talked about that last time. This piece here, the aid to states and locals, translates into this piece, and of course down to us, and this is the money that we're dealing with. And then some of the other things that Michelle was able to find a little more locally. The governor had a emergency relief fund. There was the HIRE program that provided some loans to hospitality businesses. There was another amount for grant programs. The United Way locally did a COVID-19 response fund. And so you can see that, for example, the Senior Center got $5,000 out of that. The library got $2,000, Catholic Charities got $2,000, all of these different distributions here. Then Department of Justice, as part of this CARES Act funding, embedded in it was some money that Department of Justice distributed. So that money has flown down to the Sheriff's Office, and then the Secretary of State, likewise, through the CARES Act funding. The Kansas Secretary of State got some money that was distributed to the election office. Then the Health Department has gotten a few different grants. They've gotten some COVID supplemental funding from the state. They got a small grant from Sunflower. And then the SMART, I don't even know what that one was.
Phil, this is Charlie. Are you reading from a document that we could have rather than you just listing these off verbally?
Yeah. So I don't know if you're able to see the screen, Charlie, but this one should be up.
Are you sharing your screen?
Yeah. Yeah. But we will distribute this. Michelle's gonna try and clean this up a little bit, I guess, and then we will distribute this out to the committee.
Are we able to use, is this a PowerPoint, or you're just pulling documents up as you need them?
I'm just pulling documents out of
Okay, so as Charlie said, this is definitely one we would want. So thank you, Michelle.
Yeah, but I think our time's better spent talking about agenda item number 5 rather than a detail at this time of
Right.
what's my opinion.
Right.
Well,
Okay.
we need to talk about number 5. We need to know what has gone before.
Okay. So that's the information we have. You know, I will say I appreciate the need for information, but and we'll do our best to get you something. But this is, you know, our deadlines are not flexible in terms of us coming up with something, whether we're working with inadequate information or not. So
All right.
that's what it is. So moving on, then I had item number 4, clarification on related entities. So last week we talked about whether we would try and expand the pool of who it was that we asked for reimbursable expenses. And the committee came to the decision that no, we were going to stick with cities and schools for right now. And so great, we got that information out to the cities and schools. That has generated some interesting feedback, I guess you'll say. Just a couple instances of that. One, the Salina Public Library contacted me and said, well, hey, what about us? And we said, talk to the city. I mean, you know, you're a city entity. And the city said, well, you know, they're their own taxing subdivision. So we didn't really consider them in our reimbursements. And like, okay, well, I don't know what to do about that. I think you probably should have, but I'm not going to tell you how to run your business. And then similarly, Central Kansas Mental Health talked to me and pointed out the fact that unlike other nonprofits in the community, counties actually have a legal obligation to provide mental health services, a statutory obligation. And there are some counties in which the mental health function is a county department. And if they were a county department, they would have gotten considered in this reimbursement. But here we've chosen to provide those services through cooperatively with other counties through an independent nonprofit. And so I'm like, okay, so we've got a couple of instances, and there are a couple others that have come up, the Airport Authority and some others where it's like, well, they don't neatly fit within the definition of city or not city, county or not county. And so the good news is that on the Friday webinar, the state did clarify that we can include reimbursements within our direct aid plan. So that's the good news, is we don't have to try and scramble and contact a bunch of other people and expand our definition. I think we can stick to our guns about cities and schools for now on the reimbursement side. But, and this sort of leads into item number 5, we might want to reserve a little bit of funding within the direct aid plan for some of these other entities that have incurred some legitimate expenses in responding and et cetera. So I just wanted to sort of bring that to the committee's attention, that issue is out there.
And Phil, I know that the Airport Authority has received a substantial reimbursement grant through the CARES Act. So I'm on that board, and I don't think that's something we need to pursue from the county level.
Great, one less thing. Okay, so let me see if I can pull up. I don't think I have it open yet. So the last thing, which as a couple folks have already pointed out is probably the most important thing on our agenda for today, is to have a conversation about what it is that we actually want to do on the direct aid plan. So I had put together a little thing that had been distributed to the committee with your agenda, which I just called the decision tree. And I was trying to okay, where is it? There it is. Share. Okay. So can everybody see that now?
Yes.
Thanks. Okay, so I was just trying to get it in my head, all the different decisions that would go into the direct aid plan, and I started slapping some stuff on a piece of paper, and it was all very confusing. And so I just went back to the who, what, when, where, why. Like, I think those are sort of, you know, kind of the basic questions. And started with what, you know, what is it that we want to fund? There were some ideas, somebody mentioned earlier, there were some ideas that we had talked about last week. I don't know that that's an exhaustive list. We can add or subtract from that, but I just wrote down the ones that I heard mentioned last week. Certainly we have the state focus areas that the state had talked about. And then why, you know, whatever it is that we pick as focus areas, we probably need to be prepared to relate those back to how those things have been impacted by COVID-19 and whether there's a relationship with the racial ethnic minority piece that we talked about earlier. Who, you know, what kinds of organizations do we have the capacity to fund? You know, one of the questions is very small organizations. I'll just take an example of childcare for working parents, right? We had talked about childcare for working parents as an example of something that the committee might be interested in funding. Well, at the level of Janet's daycare, right, that might be very difficult in terms of an individually owned private business, and you know, we're dealing with federal funding, clawback provisions. Is that person going to have the capacity to you know, just from a cash flow standpoint to deal with audit requirements and you know, executing an MOU and those sorts of things, versus an entity that provides childcare more broadly, that operates a number of different sites and has more organizational capacity. So I think that's a whole conversation is, you know, at what level of organization do we target? And then what can they deliver by the end of the year? And then, you know, if we have some of those very small direct service providers that don't have a lot of capacity, can we find a conduit organization that could get that funding and ultimately pass it through to those daycare providers? So just as an example. So the state did, I put this C sample from state, I can pull that up as well. The state did do a sort of a generic memorandum of understanding that is very similar to the resolution that we sent to the cities and the school districts, that we can use to deal with other entities. The other thing is, on this question, Charlie also sent me over the weekend or maybe Friday a list of some potentials as well that he had just thought of. So we could talk a little bit more about that. And then the question of how do we reach out to these folks on the publicity side, and then how do we get applications from them? I became aware that Wyandotte County, obviously much larger than us, but they have an online application form. So I just have that example. I talked to some other counties on Friday, and a couple of them went, instead of doing an application, they went the route of doing a needs assessment and just targeting things that came up in their needs assessment rather than asking for individual applications. So I think that's something for the committee to talk about. Lots of examples of how we might get the word out. And then when. So we, again, have a pretty hard and fast deadline of our August 10th meeting. We need to come to conclusions so we can turn that around and have the commission approve it on the 11th, so we can get it to the state by the 14th. So in my head, I'm thinking we probably need a couple of meetings to review whatever it is we get back from provider organizations. So if we were to meet, we talked about potentially meeting on Wednesdays. If we were to meet August 5th and then August 3rd, that would back up our due date to July 31st, potentially, which is 2 weeks if we had the application ready to go today. So alternatively, I thought about if we met this Wednesday, if we come up with some general ideas today, I could take those back, staff could work on an application, we could meet this Wednesday to review and approve that application.
Phil, excuse me, I did take a look at the PDF version that Wyandotte County was using, and how do you feel about that template? Because I think, have you played around with anything as staff yet for the application process?
We have not.
Okay, and I just, didn't know if you'd had enough time to look at that. We're wanting people to be able to kind of click, click, click and be done, I think. So we want it to, of course, meet the guidelines, but it needs to get out as soon as we can. So if you're not ready for that, we could look at it later in the week, I guess.
Yeah, so that was my alternative here, was if we got something, by Wednesday, if we did a publicity push toward the end of this week, and then gave folks 2 weeks. The issue with that one at that time frame is then we would need to do a couple meetings of this committee probably at the end of that week to actually get through all that.
As far as meetings go, I'm committed to 2 meetings a week until this is done with. So but I think for Wednesday, if we do decide to meet on Wednesday, we need to have a form, a template that's ours for application for the locals. And I'm a little bit concerned about the reimbursements that nobody's responded. The city hasn't responded. The people, the locals out in the county haven't responded. And the only thing we're obligated is the 64,000 or so from the county agencies. Am I hearing you right?
Yes, so far. I mean, we know that the city of Salina received the information because they had that conversation with the library, but we haven't gotten anything from them. I know, like we said, the smaller cities, those were all hand delivered, so we know that they got them. The school districts, they got them because actually 305, I'm sorry, 305 actually did ask me a question, so that is the one exception.
All right, so we still have until Friday for the deadline, is that right?
Correct.
Yeah, we're not going to hear from people until the deadline. That's just the way it works.
Okay. So we don't need to jar them in some way, saying there's money here for you if you want it.
I don't think so. If they don't respond, they don't respond, but the deadline was pretty clear.
Okay, all right. Well, I like the form, the Wyandotte County, the verbiage doesn't apply to us, but I like that. I like that process if that works for us.
And I believe, Phil, that they could actually do the application online with that format. Is that correct?
Yeah, that's correct.
And save it as you go. So that's user friendly.
Yeah, I'll just pull it up here.
So one of the questions you're asking is, how do we communicate to the public and the people that the direct payments, how do we communicate to them to apply? And you've listed some websites, social media, committee reports, newspapers, that sort of thing on here. Is there what are the thoughts of the committee on that?
Well, I think a press release is in order. Contact all the media. I think the list is good as a starting point to get this information out. There'll have to be some lobbying to get it up as soon as possible with those entities whose reporting staff is down to less than a skeleton crew. I think we can get some help with that if getting the thing written and getting it distributed.
Okay. So I think what I'm hearing is take what Wyandotte County did and tweak it for Saline County and go with that.
And make it as simple as possible for them so they can just get it in.
Okay. Other thoughts on time frame?
So in my hearing, we're going to be meeting at, is it 2 on Wednesday then, to having had that application?
Well, 2 is a problem.
2, okay.
The state's doing another webinar Wednesday at 2. So I was going to see if folks were available at 3:30 on Wednesday, if that would work. I got a thumbs up from Charlie.
Yeah. Fine
Could
with
work.
me.
I may be traveling, but I could certainly get it on my phone.
I'm good for that time.
That works for me.
Okay. So 3:30 on Wednesday sounds like most folks could do. And then, so then assuming you all like what we come up with and it gets approved at that meeting, then what is time frame then in terms of when we would want it to be due back to us? What's a reasonable amount of time to give these entities?
Well, back up from our due date. Is it, what is today?
Today is the 20th.
20th. And we have to submit these to the county commissioners by when?
August 11th.
So July 31st may be too soon.
I don't think it's too soon for the committee, but I don't know if, you know, that's essentially a week and a half for the groups.
And, you know, I don't know that we could do any better than that. You made a very cogent comment that we do have irrespective of data, we have deadlines that we have to meet. And, you know, that's a good faith effort on our part, I think, to commit to that. We do need to move forward.
I think what's reasonable for the entities is 2 to 3 weeks, but we don't have that luxury.
Right.
Okay. So, okay, so we can meet at Wednesday at 3:30. And before then, we will get out to you the information from Jason and the information from Michelle. And we will also try and get out a revised or a salinified version of the Wyandotte County application form and try and work on by Wednesday getting something up online as well so that it's easy for folks to deal with, and we will stick with July 31 as the deadline for folks to turn that around.
Phil, I'm wondering, Tom mentioned some sort of press release. I'm wondering if he's the guy to, with his vast contacts in that area, to work on that sort of thing.
I would be happy if Tom would do that. I will say we also have a list that we are distributing all of the COVID information to. And we do have we do Monday, Wednesday, Friday press releases. So in the Wednesday afternoon release, we could include whatever Tom comes up with now that he's been volunteered.
So when do you need it?
I would say by the time of our meeting by that 3:30 on Wednesday would be great.
Charlie, I owe you one.
No.
Yeah.
I've been blasted by the Salina Journal so many times. I'm overdue. Owen back.
It was all gentle.
Kristen, I think you started to say something, but you're muted.
No, I think you're fine.
Just saying that after that Wednesday meeting, we would have an approved application. So we definitely want to get all that out to everybody we can that day.
It should be in the press release.
Right.
Yeah.
And I just want to clarify real quick, did we identify who it is that we are sending or who our target group is for the application?
I don't believe we have.
Okay.
Yeah,
And
I
I'm
haven't.
just-
Go ahead.
Phil, I was just looking at that email from Charlie that you got and I got. Can you bring that up? That just had some names of groups that I think fit what we're looking at.
Okay, and folks see that we've got YMCA, DVAC, Ashby House, Big Brothers Big Sisters, CAPS, MLK, Salina Child Care, Catholic Charities, Salina Family Health Care Center, Emergency Food Bank, Rescue Mission, and Salina Education Foundation.
That's a pretty good net, I think. But I don't want to exclude, especially if we're looking at resources for at-risk children. I just want to make sure we hit all those organizations.
Well, and we could do, like we could send a letter, an individual letter to each of these organizations on this list, but then also, you know, put it in the press release and broadcast it more widely.
I like that.
Right. This would be a place to start, and then word of mouth may generate additional agencies.
Okay.
At one time, there was a network group for the smaller childcare places, like within somebody's home. I'll see if I can dig into that. They might be absorbed now with the Salina Child Care Group, because I know that's kind of an umbrella for some of the smaller agencies. But I'll check into that and see if that network still exists or if they're part of that umbrella.
It's a great idea.
Pam, does the list that I provided, does that take care of your food?
The Feed the Hungry program?
Yeah, right. Are there any more that need to be on there?
I'll contact the person that's in charge at our church and see who she's networking with on that. I know she does a lot of it through the Emergency Food Bank.
Yeah.
There's another organization called Salina Shares that's helping out with the Salvation Army problem that they had to shut down, but they are doing food related mission.
The one thing I wanted to bring up and we should keep in mind is that the enhanced unemployment insurance is $600 a week goes away at the end of this month. And we're going to see these organizations, I assume, hit within a couple weeks of that.
Right.
And the school district's been feeding families, not just children, throughout the summer. And I know they got some money from Department of Agriculture. I'm not sure if CARES funding has also gone to that, but that's a commitment they have kept ever since schools closed. So it'll be interesting to see what they come back with.
Yes, I had a visit yesterday with Andy Ashby House. And he said they're trying to prepare as best as they can and anticipate what's going to happen when that's done. And he said there's been no evictions during this time period either. And those are going to kick in soon. And the complexion of Ashby House could change completely, as well as many other services that we have within our community.
And I think we're united in all wanting to target those services, which are only going to become more necessary.
Yes, they are.
I had a couple other thoughts. One is the preschools, which are left out of the USD funding, but we have a preschool at our church and they go by the USD calendar. But we need somehow, there's probably a state agency that supervises them, and we could probably call Topeka and get a mailing list of the preschools in our county, and that would be helpful. The other thought I had is about quarantine aid. If you're working for minimum wage and you suddenly are sent home for 2 weeks to be quarantined, then how are you going to eat? How are you going to pay your rent? How are you going to pay your utilities? I'm not sure I have a good answer for that, but that's something I think we should give serious thought to. And it'd be interesting to know how, from the health department, how effective the current quarantines are. Because if you don't have any food at home, you're not going to stay at home.
Jason had to run out. He's dealing with something else this morning, but I do know that when they issue the quarantine orders, they say if you do not, if you need food or medicine in order to stay at home, contact us and we will arrange to get that to you. So I know they have been doing that. Michelle, do you have any more details on that?
I was gonna say, for first, the employers, when you're dealing with a quarantine, it's covered under the Family First Coronavirus. There's 3 points. So whether it's your quarantine, someone you're taking care of is quarantined, or due to a child care provider not being able to watch your children and you have to then take care of your child, that's also covered, whether that be at 2/3 your normal pay or whatever. And I don't remember off the top of my head, but I know there's a deadline to that and it's on the spreadsheet that Phil will be sending out later. Also, when it comes to you being put on quarantine in Saline County and you do need resources, whatever they may be, the contact tracers have done a above and beyond job in taking those resources to those people that need it. If we do expand outside of their capabilities, we do have the Saline County Mounted Patrol. They're also on that Excel sheet. They were given $2,000, if I remember correctly off the top of my head, for PPE for that exact service. They will go to houses and deliver household needs for those that cannot go out.
I did like Dirk's recommendation on preschools. That is just like all day kindergarten. That is a gap right now
Yes.
in the education system in Salina. And I'm wondering if staff could try to find a state agency or whatever. We just kind of need a mailing list so we can maybe reach those people also. The in-home preschools, whatever, church, there's several of those.
Yeah, I know. Well, health department has childcare licensing, but I don't know if they do preschools as well as, but I will contact them and see if we can.
Right.
Now, does that cover private schools as well for private elementary schools and high schools, or are you guys just wanting to focus on preschoolers? Private schools also haven't been covered under USD 305 and 306.
Okay.
I'm just hearing from Roxanne that the health department has a list of any entity serving children. So that should include preschools.
You cut out. Could you say that again, please?
Roxanne is here and worked in the field and said the health department should have a list of every entity that serves food to children.
Okay. Right.
So there's a starting point.
Good, that's great.
Well, I don't think we should exclude private schools. I mean, we're trying to keep everyone safe, and we don't want to be excluding people that need the help and might pass this along.
I agree.
My opinion.
That meets the guidelines, Phil?
Yes.
We're okay there?
Yeah.
Okay. Then I agree.
St. Mary's private schools fed children all through this as well.
Okay, so we'll get the private schools on the list too. Okay. Anything else? Let me go back to this one more time and see if there's anything else we needed to talk about today.
Phil, do you see any difficulty with matching up the areas of need that we've talked about addressing specifically with state guidelines?
No, not necessarily. I think we just need to, I think that should be one of the questions on the application is, you know, relationship of your services to populations that have been impacted by the pandemic, but.
That's a good point.
Yeah.
Are we going to contact the chamber and like the Greater Salina Community Foundation and the United Way?
Yes. I'll say I've already talked to those folks, but yeah, I would definitely reach out to them and ask them to distribute this information once we come up with it. So, and Eric's here, so he's hearing all of this.
Well, there's Heartland Head Start that has a lot of children's programs for at-risk children.
Yes. Yep. Yep.
Okay. So anything else for today?
I just had a quick question regarding universities. I know we talked about it last week. I didn't know if that was something that we wanted to extend that to for projects, not reimbursements, or where the committee is with that, because I'm still receiving phone calls from KU Med and Salina Technical College.
Mhm. Good question.
We have to include Kansas West and if we reach out or provide for them.
Mhm.
So I'll just say, I think it would be a little short-sighted to exclude anyone at this juncture. For my very last point up here that's on the screen is, what's our backup plan? How do we capture the full 11 million if we don't get the applications we want? And so I think, you know, even though there might be things that we would think are higher priority than others, we probably need a considerable number of applications, and then be better to be in the position of winnowing it down than trying to dig up money at the last minute. So
Yeah, I agree with that. But at the same time, we want to focus, I think, on these target areas. And instead of giving dribbles to everybody, I think I would love it to be a hard decision. But we have so many applications that we need to just kind of decide what our priorities are. So yeah, broaden the net. Just, I mean, anyone is certainly welcome to submit an application. It would be the way I'd look at it.
Mhm.
yes, so I don't think I probably need to send individual letters to higher ed because they're well aware of this process. So if they apply, they apply, but we won't make a special effort to reach out to them.
Okay.
Anything else for today?
I just want to say, Tom, that's going to be one heck of a press release. So thank you for that.
I'm going to plagiarize from the letter that was sent.
That's exactly right. Yeah.
I'll try to have a draft out tomorrow.
Okay.
Fabulous.
And I will send everybody Zoom info for 3:30 on Wednesday. We will get out Michelle's spreadsheet, Jason's charts, and the draft application.
And then I probably will have some adjustments to that because I just got an email from Department of Labor, so I'll probably have a new one on Wednesday.
Well, thanks again, staff, for all that you're doing. This is just quite a lot on your desk.
That is a true statement.
Hard to get your work done when we've got so many meetings going on too. So I know you're putting in a lot of time. Thank you for your efforts.
Well, you're welcome. This is important for the community. So one more comment somebody had?
Are we going to be able to reimburse you for extra administrative expenses out of this money? I understand.
Well, as I said earlier, we do have that contractor who's looking at getting us a proposal today. So we'll.
Okay. And as I understand it, we'll need an auditor and some.
Yes. So that is, I have reached out to our auditor last week. He is also supposed to be getting me a proposal for how much that, or technically not a proposal because we're under a contract, but a cost estimate for this particular line of work.
And I hope you're keeping track of staff overtime.
We are keeping track of overtime, yes.
And is there any need for a temporary worker? In your
That's the
opinion?
contractor that I was referring to.
Oh, okay.
Yeah.
Okay.
All right, well, any more questions?
Move we adjourn.
Okay, there's a motion. Is there a
Second.
second? Okay. All those in favor?
Aye.
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 Thank you all, and we will see you on Wednesday.
Right, thank you.
Thank you.
Thank you.